Good morning to everyone, and thank you all for joining this webinar. If you are joining from some other parts of the world, good afternoon, maybe good evening. Good to have you all here. Today, we're going to be speaking about quantifying clinical risk. We do these webinars so that we can get our message out about what we do here at Proficien, but also about giving a bit of context around the environment that we work in and some of the solutions that we try to solve at our tech company. So here this go. Let's get into it and let's discuss about quantifying clinical risk. Okay, so just how it's going to work with the webinar. We've got some polls, we've got some questions, we're going to present a bit. So the session is being recorded. If you can please keep yourself on mute throughout the time of the webinar, unless we ask you to unmute yourself and ask your question. You can, at any stage throughout the webinar, you can drop us in question in the chat or in the question box. We'll be happy to answer them towards the end of the session. And if there's any technical issues, also please just pop us a message in the chat and we'll be able to address that and be able to hopefully sort out your issues. Okay, so just to get into an introduction and what we're going to be speaking about and some of the objectives of today. So my name is Nathan. I am the founder and the CEO of Proficien, and we're going to speak about the services that we offer at Proficien, but we're going to go through, first of all, quantifying clinical risk. A lot of us as healthcare providers, we think about, the individual patient. We think about how to maximize and how to improve that patient's outcomes. But there is this whole side of clinical risk that we might not always think about, we might not take into consideration. So what this webinar is, gives you a little taste, and it's not very long, but it gives you a little taste of what it is to actually quantify that risk and get an understanding of how at risk your organization is. And then we're going to speak about some effective strategies and solutions. And then we're going to speak about our platform and what we do at Proficien. So without further ado, let's get into it. Okay, so there's a quick poll we would like you to do. So if you can just on your screen scan that QR code, we're going to give you just a few minutes in order to complete the poll. But what we want to get an idea of is your current understanding on quantifying clinical risk. Have you thought about this before? Is this something that is part of your normal operations and how you work within your organization? I'm going to give you just, it's very quick poll, but just a couple of minutes, maybe a minute or so in order to finish those questions. If you can just answer the poll now, that would be great. And then we'll move on to the presentation. Okay, so we're going to get into strategies to quantify clinical risk. These 4 strategies that we're going to speak about are certainly not all of the strategies that are available, and there's a lot more ways that you can come up with a number or a value of how much at risk your organization is of a malpractice claim. What we're speaking about here is risk of litigation. In this case, there is risk that is risk to patients' outcomes, risk to your organization financially, maybe in some other ways. If you don't, for example, complete all the documentation you need to for a patient, you might not be able to bill them. So we're speaking about here about malpractice risk, although there's many different types of risk. So what you can look at, and the first strategy is looking at your malpractice claims that you had previously. So you could look at the frequency of the claims, see if they're increasing over time. Hopefully in your organization that they're decreasing over time. You can look at the severity of the claims that have happened in your organization. Maybe you've had a really huge settlement with one patient, and you can also look at the type of claims. So what was the substance of the claim against your organization? So one of the issues with malpractice claims is it's retrospective. You're looking back at what has already happened, the risk that you've already taken on, and the consequences of those risks, that risk. So malpractice claims will give you an idea, a real figure of how much your organization has paid out before, if that is the case. And if you can extend that going forward. But what you also want to look at with malpractice risk is strategies that will preempt the next malpractice claim against your organization if that has taken place in the past. So what you can look at is patient safety indicators, and this is ways of looking at the clinical side of the medicine that you're practicing and seeing if there's any indications in that could indicate that your organization isn't quite living up to the standards maybe that you want to set, or you increasing that risk of malpractice. So you could look at post-operative complications. You could look at over a certain amount of time. You could look at how many of those complications take place and what percentage of operations results in a complication. You can also look at healthcare associated infections. So this is how many of your patients, say, if you have an ICU in your organization, how many of those patients get an infection. You could also look at medical errors. This is another way of diving deeper into your data analytics and seeing what kind of medical errors there are and how often these errors take place. So that's just another way of looking at some of the patient safety side on your clinical data side. And then you could also do this through compliance and audit scores. So there's a whole bunch of ways that you can look at the risk of your organization through your culture. So proximity of your culture or your organization to risk. And this is where you could create systems that there's, if your organization has high audits score, then normally that is associated with a decreased risk in malpractice claims. You could also benchmark against other standards, for example, JCI or some other international standards. And there's a whole bunch of predictive scores that you can make between your audits and your compliance and your malpractice risk and what the chance of those ending up in a malpractice claim. So again, it's just going back to how your organization is operating, and the compliance side and your audit side is seeing that how much is that score related to your potential risk. And then on the other sort of the last strategy that we're going to speak about is incident reporting systems. So these are when unfortunately an incident has taken place, either a near miss or an error has happened on a patient. Detecting that, reporting that, putting that into a system, storing that somewhere, and then keeping that data and analyzing that over time. So if we see that there's a lot of incident reports that are taking place that could increase risk of malpractice, you need to have a culture of transparency and safety within your organization. And just because you're not seeing these incident reports, or the system isn't there in order to report those type of incidents, it doesn't mean that it's not happening. So that's another way. If you can see these incident reports increasing or decreasing, you can know that you can understand your risk in some way. And then later on, once you've got a report, you can do a root cause analysis to see what was the reason why that incident took place. So these are just 4 strategies that I wanted to speak about, just in terms of quantifying risk. As I said, these are not all of the strategies, and this is not supposed to be giving you an idea of everything that could take place in your organization, but it is a way of just so that you can understand quantifying that risk. So if you do identify a risk within your organization, and every single organization that's treating patients is going to have some level of risk, some more than others, but what are some of the strategies that you can use in order to mitigate that risk? So just starting here, you can, and a lot of organizations do this, do simulation-based risk training, where you will create a simulation, maybe a simulated patient scenario, or a drill or something like that. And those simulated patients can help you understand where the gaps are in your organization. You can also look at the patient safety indicators. And this is, again, going back to those root causes of those audit reports that you receive, and seeing if there's ways that you can improve your organization so that these type of incidents don't happen. And you can optimize your clinical workflows and communication. We all know how important communication is within clinical practice, and optimizing the flow of patients within your organization. Many times patients will come and get a diagnosis, and unfortunately, they will go to the next healthcare provider that doesn't have that diagnosis or doesn't have that information. So ensuring that the patients have a flow within the organization that gets you from, one department to the next, and making sure eventually that patient becomes an outpatient and hopefully doesn't have an incident while in your organization. And then you can have data-driven skills, risk tools. These are looking at your data and really making targeted changes to your protocols and procedures in order to improve your clinical outcomes. And then you could also have a centralized risk dashboard. This is getting all information from all different areas, from your patient report forms, from incident reports, putting that all in one place, and then creating solutions according to that risk. So these are some of the solutions. Obviously, again, not an extensive list, but gives you an idea of some of the solutions that you can employ at your organization in order to improve your patient outcomes, and eventually that decreases your risk of malpractice.